Hey everyone, thanks for joining me on this episode. We've got our first ever Q&A session, so stay tuned, some free vet advice. We can all talk about different cases and maybe you'll learn something and have a good time at the same time. Thanks. All right, great. Let's get right down to it. So I had a client of mine bring in this gorgeous Bengal cat named Marciano, named after Rocky Marciano, which is the American boxer that actually inspired the movie Rocky with Sylvester Stallone. Interesting story. So Marciano, as I said, is a Bengal cat. Probably one of the coolest looking cat breeds you're ever gonna see. Check out his Instagram page, follow him along. You're gonna love the photos as he grows up bigger and bigger. Now, Bengal cats, interestingly enough, are actually ancestors of the wild Asian leopard, which is a small cat that was actually, you could buy them in pet stores back in the 1940s and 1950s. And it was bred, one of these cats was bred with a regular cat, and eventually you got this really cool spotted kind of domestic leopard, domestic cat looking thing. Now these cats have a ton of energy, super playful, super loyal and compassionate and loving, but they do get themselves into trouble. Now Marciano, all he had was this little lesion, kind of this dry, black, sort of scabby crust under his chin. And the owner and I kind of joked that, like a high school student, he basically had chin acne. Now, in cats' cases, it's not due to eating too much French fries or hormones or eating too much chocolate. It's kind of just a genetic thing that some cats are susceptible to. Now, Marciano's probably going to deal with this chin acne on and off, ups and downs for his whole life. However, it's not too serious. It is a bacterial infection, but it's localized, so we generally don't use oral antibiotics, though sometimes you need to. But in Marciano's case, we ended up prescribing a topical medication that is both kind of an antifungal, antibiotic, and cortisone. However, for the less severe cases, and if it's severe, talk to your veterinarian, but for the less severe cases, you can actually pick up a ointment, which is water-based. It's very important it's not cream-based, so it can't be a cream, it has to be an ointment, but an ointment sort of antibiotic product, like a polysporin or one that's actually called triple antibiotic. Sometimes you can get it with a bit of lidocaine in it or a little bit of cortisone to take away the swelling. But as long as it's water-based, it'll get in deep within those sort of infected hair follicles. Keep it clean with a little bit of hand soap, and if your cat has chin acne, things are probably going to be controlled just with that. So the second case is again another patient of mine, and the family reached out to me on Instagram because this puppy sounded like he was snoring. They sent me a video. It ended up being that he wasn't snoring. He was actually kind of coughing. It had this sort of whooping cough, sort of deep cough sound to it. So he ended up seeing an associate of mine, and he was diagnosed with just infectious rhinotracheitis. Now I say just infectious rhinotracheitis, it's actually known as kennel cough. Now kennel cough specifically is Bordetella bronchoseptica, is the organism that causes kennel cough, but you can get anything that causes a sore throat in dogs is rhinotracheitis. Rhino means nose and sinus, trache means trachea, and itis is inflammation. So whether or not he had specifically Bordetella bronchoseptica kennel cough or some other form of infectious rhinotracheitis, he was treated with some antibiotics and he'll do very, very well. The last case, very interesting. So I actually got reached out, this gentleman reached out to me on the comments section of the video that was about the cat that fell 45 feet. So make sure you check it out. This gentleman's name is Saifur. Saifur is from Bangladesh, and his cat fell 45 feet. And he reached out to me right away, and unfortunately he has no veterinarians in the area that he can bring his cat to. And he sent me some photos, and it shows clearly that his cat had fallen and had smacked his nose. And so I basically reached out to him and said, hey, can you take another shot? I want to make sure that the hard palate has not been split. In that video about the cat that I saw, he had actually split the roof of its mouth. they take a hit so hard in the face that it splits where it's a little bit weaker, and they end up needing surgery usually to correct that, or they can have some serious eating problems and get major infections. Well, thank goodness this cat didn't actually split its palate, but Seyfur was worried about some pain in the chest. The cat wasn't really walking around properly, and so I said, just stick it in a cage, like a kennel if you can, or if you don't have that, the smallest room in the house, like a bathroom. What we're worried about obviously is broken bones, but a common thing that I see with these learning to fly cats, or these high-rise syndrome cats as we call them, is they'll break their pelvis. Now cats though heal really, really well. We have this joke in the industry that if you take two ends of a bone that's broken from a cat and you put them in the same room together, they're going to eventually find a way to mend together. Obviously it's not that simple, but you get the point. So he ended up reaching out to another veterinarian online, kind of one of these pay for vet advice sort of things, and was prescribed, well, not prescribed, but he was told to pick up some azithromycin, which is an antibiotic, and to give a single dosage, which actually doesn't really make sense. If he needs antibiotics, you got to do a full course. And then he was told to give a drug called Portan, which is prednisolone, which is cortisone, which is an anti-inflammatory. So his recommendation, or the recommendation he received, was kind of a blank slate one. It was just like, give him some antibiotics and some anti-inflammatories and see how the cat did. The cat ended up doing great, but honestly it was just because Seyfur rested him properly, and the cat basically just got smacked around. It probably has some bruises and some sore spots, but is already eating well, walking around well, and shows no signs of abnormalities. So when in doubt, if you think your cat's hurt itself like that, get it to confine itself first. Reach out to a veterinarian. Reach out to me if you need to. And this is a great time if you have comments, if you have questions and cases you'd like me to look at. I'm happy to. Maybe they'll end up in a Q&A section for the next episode. But basically, reach out to a veterinarian and keep your cat confined until you know exactly what's going on. And those are the 3 cases for our first ever Q&A. So I hope you enjoyed it. I hope you enjoyed it enough to subscribe. Definitely leave some comments below whether you liked it, whether you didn't, if there's things that I need to do to change to make this thing more enjoyable or more educational. And again, I would love to help you out with your cases, so send me photos and videos and histories, and I'll DM you and we'll try and figure out what's going on, and it'll be a good time, and I like to help. Again, subscribe, share it with your friends, and last but not least, as I always say, please be kind to animals. Thanks for watching.